Across the country, hospital systems are facing a shortage of nurses. Here in Cook County, nurses at Stroger Hospital went on strike this summer over staffing shortages. Nurses say the lack of adequate staffing has led to burnout and sometimes even caused patients to be redirected from one hospital to another. Joining us to talk about the conditions that nurses are facing are Elizabeth Aquino, president of the American Nurses Association Illinois, and Elizabeth Lawlish, a registered nurse at Stroger Hospital of Cook County and a steward at National Nurses United. We did reach out to Stroger Hospital of Cook County for comment and did not receive a response. Thanks to both of you, Elizabeths, for joining us. Elizabeth Lawlish, let's start with you, please. What hospital conditions would you say are contributing to this shortage?
I think that the hospital conditions contributing to the shortage, and I just want to say that I don't think that there's a real serious nursing shortage that before COVID. I mean, there's really only a shortage of nurses who are willing to work in unsafe environments. So the conditions over the last 18 months since the beginning of the pandemic have really been nurses not being provided with optimal PPE like N95s, gowns, all sorts of safety equipment so that we can actually work with patients. And, you know, nurses have been very fearful for their lives. Some have gotten sick at Stroger Hospital and across the system where I work. And people are fearful for their families as well. And in addition, what we're seeing is that people are leaving the hospital system. They're retiring or they're looking for other jobs, or even traveling nurses that are inside of our hospital working to supplement our staffing, are planning on just working for this year and then taking time off.
And well, I want to get Elizabeth Aquino in here because you guys have a slightly different viewpoint on this. Elizabeth Aquino, you believe that you did see a shortage, currently a shortage and a shortage pre-pandemic. What was the cause before the pandemic?
Yeah, before the pandemic, we were experiencing a shortage as a result of the growing aging population, the aging nursing workforce, and the estimates expected 1 million nurses to retire by 2030. We have a nursing faculty shortage and then the nursing burnout, which Elizabeth did speak about. So yeah, the COVID pandemic has definitely exacerbated the shortage with some nurses choosing to leave earlier. I mean, I teach at DePaul and we have students who graduate and are a year out, and already, it's been a tough year for them, and considering, what other options they may have, because the exhaustion, the burnout is something real that nurses are facing. So,
and Elizabeth Aquino, how would you quantify the shortage? How bad is it?
Well, we don't have exact numbers now, but we do know that when nurses are feeling overwhelmed or there's burnout, that causes turnover. So I'm sure the numbers will come out very soon to see the direct impact, but we know anecdotally that it is happening. Nurses are not returning.
Elizabeth Lawlish, we know that a couple of months ago there was a strike with your union over staffing shortages at Stroger Hospital. How did that shortage affect day-to-day work at the hospital?
I mean, what it meant was that people were exhausted, that people, obviously, as I was saying, the conditions inside the hospital are the main factor that have contributed to, and the failure for our hospitals to actually plan for the surges around COVID. So with our strike, what we actually did was, and we hadn't struck since 1976, so close to 40 years, if not more. And not really something that in a safety net hospital is the typical thing that we do, but we actually won through our strike of one day on June 24th, a commitment in writing to hire 300 additional nurses into the system within the next 18 months from hospital management. And we've already begun that process. We had 150 people at a job fair for my division, which is called medical surgical nursing, and we're planning, and people are being hired and brought into the system. So that was part of it. Plus, with our strike, we actually won exceptionally good benefits, and so it's a very attractive package. I know a lot of hospital Hospitals are having sign-on bonuses and things
And
like that
something
to
more
try
to,
to
it
get
sounds like,
people in.
yeah, to get more nurses in.
Right,
But about
and so
exactly, about the patients though, Elizabeth Aquino, what impact does the shortage have on patients who are coming to hospitals for treatment and care?
It has a direct impact on patients, both patients who are coming to the hospital and needing services, and due to a shortage of available beds or a shortage of staffing, hospitals may have to go on bypass, and that means that patients are not able to be cared for at an institution. We know that staffing affects the quality of care provided to patients and patient outcomes, so it significantly impacts both nurses and patients.
Elizabeth Lawless, describe please the challenges, because you have this experience with working in some of the COVID hospital wards.
the challenges are, as I said, not being able to have safety measures that nurses need, as well as other hospital staff. There's been a lot of discussion about that. The challenges of having too many patients, and that's something that actually hospital systems can take care of by, like I said, having hiring fairs and really promoting bringing in nurses and retaining nurses. So those are the challenges that we face. And the idea of burnout, I think, is one that I like to flip that on its head, because it makes it seem as if it's an individual choice on the nurse or some deficiency. Whereas, what we say in our union is that it's moral distress, and that hospital systems have the money. My hospital system received $1 billion in federal COVID relief money that can be used to actually bring in more staff and retain those staff.
And Elizabeth, sorry, we've got about 45 seconds left. Elizabeth Aquino, your association worked on the Nursing Staffing Improvement Act of 2021. It has been sent to the governor for his signature. In about 30 seconds, what would that act do?
It's a holistic approach to staffing that really uses a nursing-driven, flexible staffing approach. So it helps support nurses in 3 significant ways. It strengthens the nursing voice, the direct care registered nurse related to staffing decisions, strengthens the role of the nursing care committee who address specific staffing issues within their institution. And then it also holds hospitals accountable for the provisions under the law.
Okay, we'll have to leave it there. Best of luck to you both, and thanks for the work you do, Elizabeth Lawless and Elizabeth Aquino.
Thank you.